Hi, I'm Dr. John Douillard, and I'd like to talk to you about how to get out of pain. I'm a chiropractor, and I was the director of player development for the New Jersey Nets for 2 years. I did all their rehab and their nutrition. And what I've learned along the way working with athletes is that getting out of pain doesn't require a lot of extended therapy. You can do this very quickly if you know what you're looking for, whether you're seeking a chiropractor or a massage therapist or some other type of therapy. When someone gets into pain, it's usually because the muscles have lost their blood supply. The muscles have gotten tight, and when they lose blood as a result of injury or overuse or trauma or postural stress, the muscles get tight. They're like twines of a rope, and when they get really tight, no blood can get into those little twines. And the body lays down protective tissue. It's called fibrous tissue. It's kind of like, water your grass, you get crabgrass. It's green, it's tough, it's very non-elastic. And that's what our body lays down inside of our muscles, is this fibrous tissue, which is sticky and tough. That's why we can't touch our toes as well when we're 60 and 70 as compared to when we were 20. We slowly build this fibrous tissue, you've all heard of fibromyalgia, in the muscles. And when those muscles lose their elasticity, well, guess what? They attach to the joints. And when the joints now are being pulled on by these tight muscles, the joints get tight and they lose their blood supply and the joints become stiff and rigid. And now when you move the joint, there's no blood, there's no elasticity, there's no lubricant, and they become stiff and rigid. So what has to happen is really very simple. You need to mobilize the joint and get the blood back into the joints so the muscles are attached to a lubricated joint. And you need to break up the scar tissue, the fibrous tissue in the muscle, so the muscle restores blood supply and elasticity. It's really very simple. So what you want to make sure is that you have a chiropractor or a therapist that actually can work on both the muscles and the joint in this way. My goal with all my patients is to get them out of my office in 3 visits. I typically try to get everyone healed and out in 3 visits. Obviously, there's some extenuating conditions, but for the most part, knee injuries, shoulder injuries, back injuries, we can make most of the progress very, very quickly. So please look for someone who in your area who's going to help you to do the right thing for both the muscles and the joints. There are herbs like boswellia and MSM that actually break up the scar tissue and put the blood back into the joint and in the muscles and do exactly what I do mechanically, herbally. So you can also support yourself in the right direction without becoming dependent on a therapist or becoming dependent on an anti-inflammatory. You can actually support yourself in the direction of healing those tissues so you're not dependent on recurring therapies or recurrent herbal use. So if you'd like more information about this, please take a look at my website. My name is Dr. John Douillard. Thank you for listening.